Hey everybody, Dr. Shaw here to talk a little bit about PRP and hair loss today. What happens for the majority of patients who end up losing hair or thinning hair is that the hair follicles that once used to grow hair have gone dormant. There's a cycle to our hair and hair growth, and our hair grows for a little while, then it goes into a dormant phase. And for a lot of patients who suffer from hair loss, that's what can lead to the appearance that we see, which is thinning hair, very thin hairs, fine hair counts, or just hair loss in general. This can happen to men and women both. What we do with PRP is we utilize the power that platelets have to restore growth back into the hair follicle. What PRP is called platelet-rich plasma. And what we do is we take a little bit of blood, just like you're going to your doctor's office for a standard blood draw, and we take that blood and we centrifuge it in a special tube that separates the platelets from the rest of the blood. They're suspended in what's called plasma, and plasma is the liquid component of our blood without cells. Thus, PRP is the name platelet-rich plasma. We then take that and inject it into the areas where we see hair loss, right at the level of the hair follicle. And what that does is when the platelets go into that area, they release what are called growth factors. And growth factors are a signal to our body that we need to heal something. We find growth factors in a lot of cosmeceuticals and other products that are available on the market today. And those are plant-derived growth factors. These are your own growth factors and thus can help with hair loss. The patients who are a good candidate for this are patients who have what we call androgenic alopecia. That's a big fancy doctor word for androgenic, means hormone related. So in general, what's happened is that the byproduct of testosterone, which both men and women have, gets broken down into something called DHT, dihydrotestosterone. DHT has the effect on the hair follicle of causing it to go dormant. So it's actually a hormonal result of why patients often get hair loss. This is commonly an inherited trait, generally on the mother's side. So these are the best candidates to get PRP injections. We do a thorough medical evaluation of all our patients who come in with hair loss because there are several other causes, one of which is hypothyroidism, autoimmune conditions, just to name a couple, that can cause hair loss. And so we would want to treat those underlying causes first before we'd ever consider doing PRP. So we do a full medical workup on all our patients to make sure that they're good candidates. The way it works after that is once we have that PRP and we do the injections, they're done in a series. Generally, we do 3 to 4 injections monthly. Then we have patients take about a 6-month break, and then we reevaluate again and see where we are. If we need to do more injections, another series like that, or just maintenance. And when I say maintenance, that means usually we do 1 to 2 injections in a year to maintain what we've got from the hair growth. We've been really excited about the results that we're getting with patients with this treatment, as it's a really nice option for people who want to do something who may not want to use medications out there which can have side effects to them, or someone who doesn't want to undergo a surgical hair transplant. There are some patients who PRP wouldn't work for. They have too much hair loss. They're completely bald. It's highly unlikely that we'll get much results from that. But for the patient who has thinning hair or the beginnings of baldness, PRP is a really great treatment, and we've been really excited about the results that we're achieving with that.